Vaccine hesitancy is a delay in acceptance or refusal of vaccines despite the availability of vaccine services. Vaccine hesitancy is complex and context-specific, varying across time, place and vaccines. It is influenced by factors such as complacency, convenience, a fear of needles, or a lack of understanding about how vaccines work. The term covers outright refusals to vaccinate, delaying vaccines, accepting vaccines but remaining uncertain about their use, or using certain vaccines but not others. Among the hesitant are groups known as anti-vaxxers or anti-vax, who are generally against vaccination. There is an overwhelming scientific consensus that vaccines are generally safe and effective. Vaccine hesitancy often results in disease outbreaks and deaths from vaccine-preventable diseases. Therefore, the World Health Organization characterizes vaccine hesitancy as one of the top 10 global health threats. Hesitancy primarily results from public debates around the medical, ethical, and legal issues related to vaccines. Vaccine hesitancy stems from multiple key factors including a person's lack of confidence. It has existed since the invention of vaccination and predates the coining of the terms vaccine and vaccination by nearly 80 years. The specific hypotheses raised by anti-vaccination advocates have been found to change over time. Proposed laws that would mandate vaccination, such as California Senate Bill 277 and Australia's No Job No Pay, have been opposed by anti-vaccination activists and organizations. Opposition to mandatory vaccination may be based on anti-vaccine sentiment, concern that it violates civil liberties or reduces public trust in vaccination, or suspicion of profiteering by the pharmaceutical industry. Scientific evidence for the effectiveness of large-scale vaccination campaigns is well established. 2 to 3 million deaths are prevented each year worldwide due to vaccination, and an additional 1.5 million deaths could be prevented each year if all recommended vaccines were used. Vaccination campaigns helped eradicate smallpox, which once killed as many as 1 in 7 children in Europe, and have nearly eradicated polio. As a more modest example, infections caused by Haemophilus influenza, a major cause of bacterial meningitis and other serious diseases in children, have decreased by over 99% in the US since the introduction of a vaccine in 1988. It is estimated that full vaccination, from birth to adolescence, of all US children born in a given year would save 33,000 lives and prevent 14 million infections. There is anti-vaccine literature that argues that reductions in infectious disease result from improved sanitation and hygiene, or that these diseases were already in decline before the introduction of specific vaccines. These claims are not supported by scientific data. The incidence of vaccine-preventable diseases tended to fluctuate over time until the introduction of specific vaccines, at which point the incidence dropped to near zero. A Centers for Disease Control and Prevention website aimed at countering common misconceptions about vaccines argued, "Are we expected to believe that better sanitation caused the incidence of each disease to drop just at the time a vaccine for that disease was introduced?" Another rallying cry of the anti-vaccine movement is to call for randomized clinical trials in which an experimental group of children are vaccinated while a control group are unvaccinated. Such a study would never be approved because it would require deliberately denying children standard medical care, rendering the study unethical. Studies have been done that compare vaccinated to unvaccinated people, but the studies are not randomized. Moreover, a literature already exists that prove the safety of vaccine using other experimental methods. Other critics argue that the immunity granted by vaccines is only temporary and requires boosters, whereas those who survive the disease become permanently immune. As discussed below, the philosophies of some alternative medicine practitioners are incompatible with the idea that vaccines are effective. Incomplete vaccine coverage increases the risk of disease for the entire population, including those who have been vaccinated, because it reduces herd immunity. For example, the measles vaccine is given to children 9 to 12 months old, and the short window between the disappearance of maternal antibody and natural infection means that vaccinated children are frequently still vulnerable. Herd immunity lessens this vulnerability if all the children are vaccinated. Increasing herd immunity during an outbreak or the risk of an outbreak is perhaps the most widely accepted justification for mass vaccination. When a new vaccine is introduced, mass vaccination helps increase coverage rapidly. If enough of a population is vaccinated, herd immunity takes effect, decreasing risk to people who cannot receive vaccines because they are too